And with normal aging, many women start noticing symptoms related to their vaginal health, right? It's a touchy subject, with nearly 50% of postmenopausal women suffering. Now there is a new treatment called FemTouch that's here to help. And joining us this morning to talk about this is Kelly Walla. She is an aesthetic nurse specialist over at Westlake Dermatology and Cosmetic Surgery. And good morning to you.
Good morning. Thank you for having me.
I mean, to talk about such a delicate topic here. First of all, tell us what we're talking about. What is it that women are suffering from?
They suffer from vaginal atrophy, which is the thinning of the vaginal wall, decreased lubrication, painful sexual intercourse for intimacy.
Okay, and so there's a new product out. FemTouch, what is it and what does it do?
It is a laser-based surgery, non-hormonal laser-based. It's an in-office treatment. It takes about 3 to 5 minutes to do this procedure. And we do a treatment once a month, and then they do a follow-up treatment annually.
So what does that treatment do?
It actually puts microscopic holes inside the vaginal lining of the wall and actually heals from the inside out, so causes the thickening of that vaginal wall.
Okay, so what is the pain factor here for women wondering about this treatment?
Yes, there is no pain involved in this whatsoever. This is endoscopic, so they're not going to have any type of pain afterwards, no swelling or anything.
So is there any sort of anesthesia that goes along with it? Is it local? Is it... Just nothing.
No,
you just go in and just do it.
It is not painful. We've
have a shot of vodka.
Right.
Is that how y'all do things?
No, there is no pain involved at all.
Okay.
It is, less invasive than actually having a vaginal exam.
Okay, and so when we talk about symptoms and when we talk about postmenopausal, we're talking about women in their 50s and...
Well, this can be used for any type of women, any women after pregnancy. So even premenopausal women that actually have had large babies that have that vaginal atrophy from that, or actually just don't have a lot of lubrication.
Okay.
So it can be used for any age group of patient. We've had so many for stress urinary incontinence, for leakage, because that's actually thickening.
Oh, so that helps that too.
Yes.
That's every mother I know out there, right?
Yes.
Who has that problem. And there have been other older ways to take care of that. But you're telling me
and this is a non-surgical, non-hormone-based procedure.
No, that's great. And so does insurance cover this? I always ask this.
No, insurance does not cover this.
And how much does this procedure cost?
It's $1,000 a treatment. We do a series of 3 for $2,700.
Ooh, that is pricey, though. Okay, and for women who may not feel comfortable talking about this, what's your message to them?
Every woman goes through this. I think we're all in the same boat. I think that it's very important to get your vaginal health under control and to feel better about yourself and in your life. So I think it's great for everybody, and it's definitely worth it.
To learn more about FemTouch, you can go to westlakedermatology.com to get more information. Thanks again.